My name is Tracy Wheeler. I'm a board-certified acute care nurse practitioner at the Liberty Hospital Advanced Spine and Brain Center. Before becoming a nurse practitioner, I worked for 8 years in a neuroscience ICU. I followed a lot of fantastic nurses and neurosurgery nurse practitioners, and ultimately knew my goal would be to someday become a nurse practitioner. I believe in a patient-centered approach to medicine. It's important to me that my patients understand why they're having the symptoms that they're having. I spend time with my patients reviewing normal anatomy, their pathology, and also comparing the two with their images. I think it's important that patients can make good, educated decisions on their treatment options, and it's my goal to get them to that point. Several years back, I worked here as a bedside nurse. I was always impressed with the excellent patient care and the community feel that you have here at Liberty Hospital. I'm excited for the opportunity to be back here and serve the patients in my community. I make an honest approach with every patient to treat them as if I would want my family to be treated. I believe it's important to be honest and open with them so that they can trust me as their provider. What do I do outside of work? I'm a mom, and I'm always momming. I'm married with 2 small children, and lately we spend a lot of time at the ballparks. As a nurse practitioner, I take an active role in both the clinic setting, hospital setting, and the operating room. In the clinic setting, I can see new consultations, review their imaging, symptoms, and begin their treatment process. In the operating room, I serve as a first assistant to Dr. Ree. Several years back, when I was working as a critical care nurse in the ICU, I had a patient with a severe traumatic brain injury. There were many discussions with her family as to whether or not to take her off of life support. Ultimately, after a discussion with the neurosurgeon there, the family decided to continue aggressive treatment. At the time of discharge to a rehab facility, she was not breathing on her own, she was not communicating, she couldn't track you across the room, she was not moving her extremities. At that point, I never thought I would see her again until 3 months later, she walks back into the ICU. She's walking, she's talking, she's interacting with me, and it was probably the most rewarding experience I've ever had in my career. It was also one of the main reasons I decided to become a neurosurgery provider.